you mean exactly?
So at times there is a history that is provided or a potential mechanism of an injury, which I would kind of relate to the medical knowledge in the field to see if those injuries are consistent, with the ultimately diagnosed injuries as well. So sometimes there is a history that is provided to at other times, and probably more difficult is when there is no history in order to really pinpoint an exact cause.
Okay, that's fair. And so if there's no history provided, there might be some limitations on your ability to say something.
Yeah.
Okay. Thank you. I'll have more questions later, but Judge, I have no objection.
All right.
Proposed.
Without objection, the doctor is so called.
Named Daryl Hicks Jr.
Yes.
And how old was he when the case came to you?
I believe he was 7 weeks old. I saw him.
When and how did the case come to you?
So the case was brought to my team, the child protection team, after he had been admitted to CS Mott Children's Hospital, and other medical professionals had concern for physical abuse as a cause, or as a due to the injuries that were identified in Daryl.
And I'll ask you some questions about that, but before I do, did you personally observe Daryl Hicks Jr.?
Yes, I did.
Your Honor, if I may approach, before I do so, showing defense counsel People's Proposed Exhibit number 2. Yeah.
I'm handing you People's Proposed Exhibit number 2. If you could please tell the court if you recognize what that is. Yes, this is a photograph of Daryl in his hospital bed. And this is what he looked like at the time I observed him.
And when you say Daryl, are you referring to Daryl Hicks Jr.? Just to be clear. Thank you. Your Honor, I would move to admit People's Proposed Exhibit number 2 at this point.
Any objection or voir dire?
No, Your Honor.
Exhibit 2 is admitted. Thank you.
So when you saw Daryl Jr., what did you note upon seeing him or examining him?
So he did have many medical interventions that were already in place. So he had EEG, which is electrodes that are placed on the scalp in order to monitor brain activity. He also had a monitor that was actually placed inside his skull operatively to monitor pressure inside his skull. He was intubated and mechanically ventilated, so he had a tube placed down his throat in order to help him breathe. And had a number of other vascular lines, so IVs and other access.
Thank you. And what was the process in evaluating him medically? Could you tell us about that?
So in addition to my physical examination, I also gathered history by reviewing medical records. So what was available in the University of Michigan medical records. And also reviewed laboratory testing, so blood work that had been Daryl Jr. had a CT scan of his head, MRI of his brain, had X-rays performed as well. So I reviewed those personally and with a radiologist as well.
I want to kind of take them one at a time. So you mentioned the CT scan. Could you tell us what the results of the CT scan indicated?
So the CT scan was performed just a few hours after Daryl Jr. had presented to the hospital. And that CT scan showed evidence of swelling of the brain, in addition to some scattered areas of bleeding or hemorrhage inside the skull that appeared to be between the surface of the brain and the inner surface of the skull.
And what did those injuries indicate to you? What would those suggest?
So the bleeding inside the skull would suggest potentially some trauma. And then with the swelling and the signs of poor blood flow and oxygen flow to the brain would again suggest that there was some injury that occurred.
What did you do next after the CT scan, or what was done next?
So after the CT scan, Gerald Jr. was admitted to our pediatric intensive care unit. And just a few hours after that, actually into August 31st, he had an MRI of his brain as well.
And what is the purpose of the MRI following the CT scan?
So there are some limitations to the CT scan. It does not give great pictures, so it just gives a clearer picture of the injuries that were seen inside the skull, and also again to look at that brain tissue to see if there were any additional injuries.
And what were the results of the MRI?
So it confirmed again that there was bleeding or hemorrhage between the surface of the brain and the inner surface of the skull. And again, showed evidence of poor blood flow again and poor oxygen to the brain. There was pretty diffuse brain injury at that point. And
did that confirm what the CT scan had shown? And
yes.
Did that provide any additional information on top of the CT scan, or is it more of a confirmation?
More confirmation.
And results of the MRI came back.
So I believe that he had the x-rays done next. We call that a skeletal survey. So it's a set of x-rays, usually about at least 20. That looks at all of the areas of his body, so from his skull all the way down to his toes and hands, and to evaluate for any skeletal injury, any fractures, broken bones.
And was there anything concerning on the x-rays?
In Gerald Jr.'s right tibia, which is the bone that you can feel in the front of the shin, but down at the end nearest his ankle, there was a bony fragment that was seen on the x-ray that suggested potentially that there was a fracture at the end of that bone.
Did you also, what did you do after the x-ray was completed?
So I believe after the x-ray that Gerald Jr. was taken to the operating room with the pediatric neurosurgery team. And that is when that monitor was placed inside his skull to monitor the pressure inside.
And what was that monitor indicating?
So at the time that it was placed, the goal would be for the pressure to be approximately 15 millimeters of mercury, but at the time of its placement, it was in the mid-20s. So it would suggest that there was certainly increased pressure inside his head.
Was there also an eye exam conducted?
Yes, there was.
Okay. And could you tell the court the results of that eye exam?
So the pediatric ophthalmology team evaluated Gerald Jr. And they found hemorrhaging or bleeding in the retina. Those areas of bleeding in the retina were diffuse, just meaning widespread, and really covering all of the retina. They were very numerous, too numerous to count, even to visualize each of the spots of bleeding in each of the hemorrhages. And they were also in multiple layers of the retina. So they were just very widespread.
And based on your training and experience, what does that suggest to you?
So that pattern and the nature of those retinal hemorrhages is most consistent with an abusive etiology that is seen typically with an acceleration, deceleration type injury.
Is that what's referred to as kind of shaken baby or a shaking movement?
Yes.
You mentioned that you reviewed other medical records. Did you review birth records for Gerald Jr.?
Yes. Gerald Jr. was born at the University of Michigan, so there was access to that information, and as well as his pediatrician records as well.
And was there anything from the birth records or the pediatrician records that indicated any concerns related to or would be associated with the injuries that you saw?
Really a normal delivery and really normal pediatrician.
And when you say pediatrician records after, are those like well visits essentially
Yes.
for the baby? And those were normal as well?
Yes.
After evaluating Darrell Jr., reviewing the medical records, taking the history, putting it all together, did you have a diagnosis?
It was like a diagnosis.
Okay. And what was that diagnosis? Could you please tell the court what injuries were specifically consistent with the diagnosis of abusive head trauma?
The inside the skull that I described, as well as the diffuse swelling of the brain, likely secondary injury to the brain as a result of that lack of blood flow and lack of oxygen delivery to the brain, as well as the retinal hemorrhaging. Again, it was of a pattern or nature that would be most consistent with abusive head trauma. And then ultimately, with further imaging, there was also confirmation of the fracture described at the, on the right tibia.
And with the confirmation of the fracture, what's that indicative of when you see a fracture like that in a case like this?
So this particular fracture was just described as a corner fracture, which just meant that it looks like there was a chip off the corner of the bone. But at that location, typically those types of fractures are due to some shear forces at the joints, as well as tension, so almost pulling apart of that joint as well. So in the medical literature, those particular types of fractures are highly specific for abusive injury, and they have been reported to be associated with shaking, so that the extremities are kind of flailing, and then that shear forces at the joints would cause these types of injuries. At other times, the corner fractures have also been described from like a yanking on an extremity, or even picking an infant up by that extremity. So almost using that extremity as like a handle or lever.
Okay. In these types of cases, when a patient is presented to the hospital, do you instantly look for, was this abusive or not, or do you start in a more general fashion?
So yes, the medical team definitely started with a more broad differential diagnosis. So thinking about all the possibilities that could lead to the seizure-like activity that Darrell Jr. actually presented with. So there was consideration given to other neurologic causes of seizures. If you have, epilepsy or some kind of, seizure disorder that might be causing this. There was consideration given to infection. So it's placed on antibiotics as well. But again, the imaging that was done really pointed towards.
Okay. And based on your training and experience, what's the relationship between the severity of the injuries and onset of symptoms?
So in abusive head trauma, the more severe cases will typically present more immediately, so closer in time frame to their development.
And was this a case you would, where the injuries would be classified as severe?
Yes.
Right now, thank you.
All right. Cross-examination.
I'm going to pick up where Ms. Tanha left off. She talked about the onset of symptoms. And it seems like, is it possible that twitching or shaking is one of the symptoms that might go along with these types of injuries?
Yes.
How long would you estimate that the onset of twitching or shaking would arise after such an injury like this?
I would say my best guess would be hours at most, but could be even shorter as minutes after an injury.
Okay. How many hours, like at the maximum?
With like seizure-like activity, I would say maybe up to 24 at most.
Okay. When that twitching or shaking is observed, I mean, is it fair to say that it's important to bring a child to the hospital right away?
Yes, if there's seizure-like activity.
In looking, in one of the, something that happens along with the injuries is that the brain doesn't get oxygen, right? And that can result in further injuries.
Correct, yes.
In your notes, in the medical records, it seemed like you had a concern for medical neglect.
Initially, yes.
That Darrell Jr. had evidence of hypoxic ischemic brain injury.
Yes.
Could you explain that?
So hypoxic just means low oxygen, and then ischemic meaning that there's no blood flow. So
Okay.
what I was describing, I just didn't use those ones.
Sure. It seems like in your notes, you stated that injury presented at the time that he came to the hospital.
Yes.
And in your notes, you write that the development of like such a problem, may have been affected had the child been brought to the hospital sooner.
Yes, I think, identification of a problem and then evaluation and treatment of that problem would absolutely, yes.
Okay. Okay. You said it could potentially change the outcome. How is that? Like the treatment could reverse, or not reverse, but like help prevent it from getting worse?
Yes, I believe that, yes, if he was treated in a timely manner, the medical professionals might be able to slow the progression, of that, injury as a result of lack of blood flow and oxygen delivery.
Okay. It seems like when we're talking about the abusive head trauma, the shaken baby stuff, it's the brain moving around in the skull, right? That leads to the bleeding and the swelling.
Yes.
And you had testified that often that can be from acceleration or deceleration.
Correct. Yeah.
Like a back and forth movement.
Yes.
It also can come from like impact as well.
Yes.
And something like in this case that, we don't have any evidence of like, skull fracture or anything, right?
That's correct. Yeah.
But this type of injury could be caused from an impact with like a soft surface,
Potentially.
like a couch or a mattress.
Yeah.
Okay. About further these types of injuries, could this be caused, if a child is like aggressively picked up from the armpits and like rocked back and forth?
I would expect the injury would be violent and repetitive as well. So I don't think that it would occur from typical injuries.
What about if the child was picked up and then the child's head hit something like the person's arm?
If that was the only injury, I would not expect this substantial injury.
What about, and I'm going to ask you if all these things in combination, I'll just save the suspense, what could possibly add up, right? What about picking up the child's head without support and the head like flop back?
Again, I would expect it to be repetitive. So I would not expect this pattern of injury with that history.
What about dropping the child onto a bed?
Again, I wouldn't expect the extent of injury.
But dropping a child on the bed, that could lead to the brain moving around, right?
Yes.
And once that brain moves around, that can lead to swelling of the brain?
Well, if there's injury to brain tissue, cause that swelling.
Right. So And I had asked you earlier if the brain could move around and like that type of scenario and impact with a soft surface. And you said that the brain could do that. But there could be bleeding from that kind of impact as well, right?
Yeah, well, I think bleeding from the movement of the brain inside the skull, yes.
Okay. And I mean, all the actions I'm describing, in some way, there's like a lack of support to the head, right?
Yeah, so the head would be basically able to move somewhat freely.
And that's part of the problem with shaken babies is that the head is not being supported while something else is happening, right?
Well, yes, there's, repetitive, again, forces being applied to the child's head.
Right. And if there's not support to, stop the acceleration or deceleration, that's when problems arise.
Yes, that's when that bleeding happens. That's when the injury to the brain and swelling can occur.
I heard you say that you had a diagnosis. It was like a most likely diagnosis. I'm gonna have to ask you what that means, most likely diagnosis.
So I was not present and did not see immediately, before or kind of what the inciting event specifically was. But in, again, evaluating Daryl Jr. while he was in the hospital, there was what we call a differential diagnosis. So which is basically a list of possible problems that could lead to his clinical presentation. Through the course of his hospitalization, through the imaging, the lab testing, then the medical team was able to, rule out some of those possibilities. And then some of those, studies also provided support to other possibilities. So once everything was completed and injuries that I outlined previously were found, I believe that abusive head trauma is most likely diagnosis.
And we had talked earlier about like limitations in coming up with something. Were you able to read any police reports?
No, I only read police reports.
Did you have access to any statements from the parents as like the investigation went on about, admissions or statements about what happened?
I believe, yes, that I had just conversations with police about some possible histories or mechanisms of injury.
Okay. Thank you, Doctor. I have no more questions.
All right, any redirect?
Just a few. Sure. How important, if at all, is the history you receive from, let's say, a caregiver or parent when a child comes to the hospital?
So I believe it's important so that medical professionals can kind of tailor the treatment, or again, kind of move those potential diagnoses around in that list of what's more likely. So if we're given a history of an injury or a potential injury, then we might be able to kind of look for additional injuries, or again, kind of potentially get to imaging and diagnosis sooner.
So would it be fair to say that it's important that history is as accurate as it possibly can be?
Yeah.
Thank you. You were asked about kind of different scenarios where the baby's head might hit a person's arm, where the head might not be supported. Would any of that describe or be consistent with the injuries that you saw in Daryl Jr.?
No.
Including the fracture to the tibia. Why you call it a most likely diagnosis, and of course you said it's because you weren't there, you didn't see what happened. Is that common in your field of work, is that there aren't people who are what we would call witnesses to what happened?
That's right.
Thank you. Nothing further.
Can I ask one follow-up, Your Honor?
You may.
Doctor, you said you had access to the University of Michigan records. Did you also have access to the records created by Tia Braxton?
I believe so. She is part of the maternal infant health program.
Well, she is the at-home social worker that does the home visits. And were you able to review those as well?
Yes.
Did you review the notes for the day that Daryl Jr. was admitted to the hospital?
Yes.
And are you able to share what those notes say?
I'm going to object, Your Honor. At this point, that's hearsay unless there's some reason there's not.
Respond.
Well, I'm just trying to figure out how what's in those notes plays a role in her diagnosis.
No, I get that, but I'm going to sustain the objection.
Okay. I guess we'll have to ask her.
Thank you. Anything else, Ms. Tan?
No, thank you, Your Honor.
Thank you, doctor. You may step down. This witness can be excused. No objection. This witness is excused.
Thank
You may call your next witness.
You will call Dr. Carl Schmidt. Stand.
Doctor, please come forward to be sworn.
Right hand, do you solemnly swear and affirm the testimony you're about to give be the truth, the whole truth, and nothing but the truth. State and spell your first and last name for the record, please.
My name is Carl, C-A-R-L, Schmidt, S-C-H-M-I-D-T.
You may inquire.
Thank you, Your Honor. Hi, Dr. Schmidt. Thank you. Good afternoon. Thank you for your patience. Dr. Schmidt, could you please tell the court where you were employed in August of 2024 and in what capacity?
At the University of Michigan Department of Pathology, professor of pathology, also deputy Washington Continental Exam.
Thank you. Could you please tell the court about your educational background and training?
I'm a physician, licensed practice resident in Ohio, Michigan, and Washington State. I have residency or specialty training in anatomic and clinical pathology. Then I have subspecialty training in forensic pathology, and I am board certified by the American Board of Pathology in anatomic, clinical, and forensic pathology.
Thank you. Your Honor, if I may approach and I'll show defense counsel what's been marked as people's proposed exhibit number 3. He was also sent that before the hearing today. Dr. Schmidt, I'm handing you what's been marked as people's proposed exhibit 3. If you could please tell the court you recognize what that is.